Hi, welcome to the Hills Academy Risk Adjustment Made Easy, the Medicare Advantage kind of learning series. I am your host tutor, Dr. Prince Bewa, and we are glad that you are able to join us in this last series in the episode, What is Risk Adjustment and What is the Implication for some identified stakeholders. If you have not watched the previous videos, they are in the description in the show notes. Next week, we will be having a live Q&A as we've described in our monthly cadence of videos. So next week, join us at 6 p.m. The registration and the link are going to be on the description below or on our website, thehillsacademy.com. Today, we'll be going through some of the implication of understanding risk adjustment for some identified stakeholders, the health technology solution providers, fraud, waste, and abuse investigators, health policymakers. For health technology solution providers need to understand risk adjustment to ensure that the necessary information that is documented by the healthcare providers and coded by the medical coders are submitted accurately. Many of these submission processes are done with technology. They are submitted accurately and completely and also timely by the technology vendors to the health plans and also to the federal government, in this case to CMS. Just imagine that a technology provider or a technology vendor solution is unable to submit all four of Mr. Clark's diagnosis. Just imagine the vendor only sends two because of a glitch in the system. Then this is going to affect Mr. Clark's risk score, and it's going to affect Mr. Clark's expected cost, which will also affect how much money the health plan is likely to get. So technology solution providers need to be understanding these processes and developing solutions that are able to capture everything accurately, reconcile the data that comes in from CMS to the plan, to the providers, and the providers to the plan to CMS, and helping reconciling all these to make sure providers and the plans have accurate insight in this risk adjustment process. And that is one of the ways that health technology solution providers understanding of these risk adjustment processes are able to help. Our next stakeholder that we'll be talking here is the fraud, waste, and abuse investigators. If you haven't seen it already, the Health and Human Services Office of Inspector General, the OIG, have had a lot of reports on Medicare Advantage overpayments. And as a fraud, waste, and abuse investigator or evaluator, you have to understand risk adjustment, right? You have to understand what are the processes to these payments, what are going into these payments, how are these payments calculated, in order to better align all these together after they have been paid, and then reconcile and see where there might be potential fraud, waste, and abuse investigations, right? As an investigator, knowing risk adjustment will know what factors go into the calculation, how to better observe for risk adjustment. There's the RADV, which is the risk adjustment data validation, where there is a check to the medical record to see that the reported diagnosis was actually in the medical record as it was stated that a plan may have gotten payment on it. So understanding these processes, and also even when plans get payment on a risk score, reported risk score 4, and double checking if indeed that money that was received was used to provide services to Mr. Clark. All these are necessary and needed for a fraud, waste, and abuse investigator or evaluator as you go through risk adjustment process to understand these to better do your job very well. The next stakeholder is health policymakers. The health policymakers are basically the architects of this system. So the health policymakers drive the policies that drives the risk adjustment process. So for example, what diagnoses are eligible for risk adjustment after all the diagnoses are collected? What are the factors that the risk adjustment factors, and how much each factor translate into money. All these are put together by health policymakers. And as a health policymaker, you have to understand these processes. You have to understand risk adjustment, what has been done before, what changes are being needed in the policy, how is it affecting patients, how is it affecting providers, how are we driving patient access and equity through these processes. So health policymakers help to make sure these policies drive the estimated cost, right? Drive the risk score and drives the estimated cost. Miss um, Jones has only one diagnosis that drives the estimated risk score and also the cost. These are the stakeholders that we identified for this episode that we wanted to describe through. So thank you so much for joining us. And as always, there is a corresponding cheat sheet that goes with this episode. And you can find them on the Hughes Academy website. If you navigate to the Hughes Academy website, like here, and you go to the resources, and there is the Medicare Advantage Risk Adjustment Basics 1. What is risk adjustment? You download the PDF or the PNG, and it has a definition for risk adjustment and has all the things that we have discussed in this video episode to freely download. And also, again, if you have not downloaded our signature gift, here is From Chaos to Clarity, the Essential Medicare Advantage Risk Adjustment Data Sources Comparison Cheat Sheet. And you can easily download it. It compares risk adjustment data sources from claims data to RAPS data to encounter data, EDRs versus chart reviews. Has a quick comparison cheat sheet for you. So you can also download it from the website, and the link is also in the description. Thank you so much for joining us in this episode. It's been a great learning experience for all of us, and I look forward to next week with the live Q&A at 6 p.m. Catch you next week.